All right, it's about 4:01, so why don't we go ahead and get started then? Welcome, everybody. If you are here for the Coping Through COVID-19 webinar self-care series, welcome, you're in the right place. Today we are going to be talking about worry versus anxiety versus fear versus stress, and how knowing the differences between all of them can help you to know when it's time to seek support for anxiety. My name is Sarah Moskel. I use she, her pronouns. I'm the health education coordinator for student wellness. And Andrea, if you want to introduce yourself real quick.
Sure thing. I'm Andrea Drett, Associate Director for Student Wellness at Counseling and Consultation Services. I use they, them, or she, her pronouns, and just excited to get to have this conversation with you guys today.
Thanks, Andrea. So what specifically are we going to talk about today? Well, here's a rough outline. We're going to touch briefly on mental health and what that means, as anxiety is in the wheelhouse of mental health. We'll then dive into what are the differences and characteristics of worry, fear, stress, and anxiety. Lastly, we'll wrap it up with how you can seek support and help a friend seek support, and we'll provide some helpful resources for you. If you have any questions, please feel free to use the raise your hand feature, which is at the top of your screen, or type in the chat and we'll answer any questions that you may have, and there'll be time for questions at the end as well. With that, I'm going to turn it over to Andrea to start talking about what is mental health and why it's so important.
So if you were with us a couple weeks ago, we did our Mental Health 101 information series. And so if you were part of that, we're going to repeat just a little bit of that. But does anybody, if you attended that or not, have any thoughts on what mental health is or why it's important? You can put that in the chat. Feel free to unmute. Any reasons or any thoughts on what it is or why it might be helpful to know about? So understand that it's late on a on a Monday. We appreciate you being here. Um, Lots of people have lots of thoughts on what mental health is or what it could be or why it might be important, but we took the definition from the WHO, so the World Health Organization, and mental health is the general state of well-being where one recognizes their abilities, can cope with normal stressors of life, can work productively, and are able to make contributions to one's community. And so when we think about mental health from that perspective, it really is that general overall wellness that folks can experience and have. And being able to cope, I think, is a really big piece of that, right? So as you're experiencing normal stressors of everyday life, being able to get to work through those and cope with those and stay afloat, if you will, helps that mental health be better. So then when we're thinking about why it might be important, again, we think about well-being as these dimensions playing together, and emotional well-being, social well-being are part of that. Those are both big pieces of our mental health, right? Our physical well-being also influences our mental health. The environment, our intellectual well-being, our spiritual well-being, our occupational well-being, all really can impact in big ways our mental health and how we are feeling mentally. So it is that essential part of your well-being in the sorry support. So again, as I was saying, all of these things play together. So again, being able to cope with daily stressors, support our physical wellness, nurture relationships, being connected and contributing to society, working productively, all of these things both are impacted by and support our mental health, right? So as we're realizing what our full potential might be and how to reach our goals, having positive mental health, taking care of our mental health, being mentally healthy are all ways of supporting our well-being. So or COVID. No, wait. No, what is mental illness? Sorry. So if we think about mental health, then we're thinking on the opposite side. So same as our physical health, there may be physical illness, right? So as we think about mental illness, any thoughts on what that might be? Anybody want to chime in? Okay, so mental illness are those things that impact our mental health, and the changes in thoughts, feelings, or behaviors, and these are things that end up impeding our functioning in the areas of our life on a daily basis. So that might be relationships are impacted, work or school are more challenging or not fulfilling, everyday activities aren't full of the joy that they normally are or are being impacted in negative ways. We're not finding interest or ongoing support in our mental health. So mental illness are those conditions that might impact that. This is a really common experience. So 1 in 5 adults in the US experience a mental illness in their lifetime. And as with our physical illnesses, mental illnesses are manageable, they're treatable, and you can come out the other side as a healthier individual. And so as we think about mental health and mental illness, it's very similar to our physical health and physical illness. You got to take care of yourself. You have to do some stuff sometimes to improve those feelings of well-being. So now in talking about COVID, our mental health has suffered significantly. So lots of studies are already showing the negative impacts of COVID-19 on anxiety, feelings of stress. It's really, really common that these have been exacerbated in this time. As we are trying to cope in new ways and don't have our typical ways of coping that can impact our mental health. So as we think about the next pieces of that, um, maybe. Oh, so um, Active Minds is a student organization, a national student organization committed to spreading awareness and on mental health issues and mental illness impacts. And they did a study early on in the pandemic and have continued to collect information. And over 80% of students reported COVID-19 had negatively impacted their mental health, and 91% indicated that stress and anxiety were the most common ways COVID-19 had impacted them. And so when we're thinking about that, that was part of why we really wanted to start this conversation with students about how COVID has impacted us and our anxiety and stress in this time. I'm going to turn it over to Sarah to talk a little bit more about some of the specifics.
Yeah, thanks, Andrea. And Andrea really hit it on the head about why we wanted to touch upon this topic, because stress and anxiety has been so prevalent. And so we wanted to kind of illustrate what is fear, what is stress, what is worry, what is anxiety, and why knowing the difference can really help you out. So I'm going to break each of those experiences down, and I'm going to start with fear. So fear, simply put, it's an emotion and a physical response due to an imminent threat. Imminent meaning the danger, the threat is right there. It's scary. It's right in the moment. And so this fear is very clear and it's right there again in that moment. So an example, you're hanging out on the couch and then this big spider comes crawling up and maybe it jumps on you. And that may cause you to like jump back, to have a fear response. So you have that emotion, I'm scared, I'm shocked, I'm shook that a spider came out, and a physical response of your heart might beat really fast, that adrenaline, you jump back, you get really tense, heavy breathing. That's the physical response to fear. And that physical response to fear is stress. So stress is your body's response to a threat. It's that fight or flight response, if you've heard of that before, and it involves your entire body working together to keep you safe. Stress helps you to rise to a challenge or a fear or a threat when it comes your way. And your body does this by pumping more blood throughout your body. You breathe faster, your pupils get dilated, you're like ready to fight or flight. And so sometimes our fear is perceived. So maybe some of you, when I gave that spider example, you're like, Sarah, big deal, it's a spider. I'm not scared of spiders. But for myself, I perceived spiders as a threat, which caused that fear response. So we have fear, the emotion, paired with the physical response, stress. And now we have the third one, which is worry. So worry is the mental distress in the form of thoughts. And this mental distress or thoughts is due to an anticipated threat. So fear, the threat is right there, it's imminent in the moment. Whereas worry, you're thinking about a future or anticipated threat. And so where does anxiety come into play into all of this? Well, anxiety is really a combination of all three of those. The fear, the emotion, basic response, the physical response of stress that your body does, and the mental distress, the anticipation of a fear or a threat. So anxiety, an emotion and physical response due to an anticipated threat. The other thing about anxiety is that it's not necessarily right there in the moment, and it's not necessarily specific. It's more broad. Anxiety lasts a long period of time, whereas that fear response is really right there in that moment. So the big key points I want you to take away from differentiating between all three of those is, one, anxiety involves fear, worry, and stress. The physical response of the body, stress, the emotion, the fear, and the worry, which is the anticipated thoughts. I also want you to know that it's okay to occasionally experience anxiety. Anxiety, fear, worry, stress, our body is wired, physically wired to experience all of these. And so, of course, it's okay for you to experience these. But here's the biggest point, if not the biggest point of this whole presentation, is that we want you to be mindful of when the anxiety becomes difficult to manage, when it's frequent, persistent, and overwhelming. That's when it's time to seek some support to help you out. And you might start getting into the territory of an anxiety disorder. An anxiety disorder is usually when that anxiety becomes overwhelming. But what specifically does that look like? So we're going to dive into what anxiety disorders are, and we're going to identify some of the characteristics of them. So anxiety disorders are a group of disorders characterized by an emotional state of fear and worry, like we discussed, and excessive apprehension that impedes functioning and difficult to control. Simply put, anxiety disorders are anxiety is the main feature, and that anxiety impedes your functioning, is difficult to manage. Now, some of the ones we're talking about today, we have listed on the screen: general anxiety disorder, panic disorder, social anxiety disorder, and specific phobia. So those four are the main anxiety disorders. Some closely related ones we're just going to touch upon is OCD, obsessive compulsive disorder, and post-traumatic stress disorder. Now, those aren't primarily defined by anxiety, but anxiety is very prevalent in how they present themselves. Before I dive into the disorders, I really want you to keep the following in mind. First, we really encourage you, don't diagnose yourself. It is so easy to do that, and it's very human nature to want to label ourselves. We say don't diagnose yourself because truly talking to a professional who is licensed and trained to help you identify your symptoms and to potentially provide you with a diagnosis is where you want to go. Also, with anxiety and separating it from the occasional to the impeding functioning is exactly that. The anxiety impedes your functioning in many of those areas of well-being we discussed, and it occurs over a long period of time. So occasional anxiety would be, maybe you have a week that you're really anxious about an exam and then it goes away. Other times, maybe you're anxious about a specific class that lasts a whole year or two or so forth. There's your differentiation. And lastly, we do want to acknowledge that anxiety is prevalent in many other mental illnesses. So we want to take the moment to acknowledge and validate that, but today we're specifically going to talk about those. So the first one, generalized anxiety disorder, also known as GAD, as a lot of people abbreviate it, is one of the most basic anxiety disorders. It's that difficult to control worry on more days than not for at least 6 months and has 3 more symptoms. This is that time frame that I was really mentioning, which is why I wanted to include it in this definition. So if you're having anxiety maybe once a week for you have it for a string of a week and then you don't have it for a really long time, you probably don't have GAD. If you're having it almost every single day for 3 or 5 years or most of your life and it impedes your functioning, you probably have GAD. So along with that difficult control worry, there are some of the symptoms on the screen that you may be experiencing. These are those physical feelings that are accompanied by the worry that I was emphasizing before. So irritability, increased heart rate, hyperventilating, difficult to concentrate, maybe you have GI stomach problems. All of these are paired with the worry. So you have the worry and then, oh no, I'm having bathroom problems. Or I have the worry, why is my heart beating fast all of a sudden and won't go away? They're paired together. Other anxiety disorders, again, these are super simplified. I'm just going to emphasize the key characteristic in each of them. Panic disorder is exactly how it's defined. It's a frequency of panic attacks, and it's a fear of panic attacks as well, of them occurring again. Panic attacks can best be described as it feels like a heart attack. It's not. You feel like your heart's going to come out of your chest, extreme hyperventilating. You may get tingliness in your face, fingers, hands, body. And also, just as a fun fact, you can't actually die from a panic attack. That is medically not possible for you to die from one. So sometimes that thought can help you if you are having a panic attack. Social anxiety disorder, again, simply put, it's anxiety in social situations. Now, we all experience anxiety in social situations from time to time, of course. But again, the key is that it impedes your ability to function in those moments, and it occurs over a long period of time. And so those with social anxiety disorder often intentionally avoid the social situation because of the intense anxiety they feel around it. Specific phobia, again, intense anxiety, worry, fear, physical sensations that are accompanied by a specific thing, a specific experience. Similar to social anxiety, they intentionally avoid it because it's so intense, difficult to control. The last 2 disorders I'm going to briefly mention. The first is obsessive compulsive disorder, which simplifying it is difficult because it's a very all-encompassing experience that impedes many areas of your life. But I'm going to break it down into its 2 main parts, the obsessions and the compulsions. So that's the O and the C in OCD. So obsessions are intrusive and unwanted thoughts that cause anxiety. So this is the worry. The thing is that obsessions, again, those two key words, they're intrusive and they're unwanted. So you have a thought that just comes into your head out of the blue, and it's a thought that you do not want, but it hangs out in there. And so to try to get rid of those obsessions, those unwanted thoughts, you perform compulsions. And that's behaviors that one feels in order to suppress the thought and the anxiety. So OCD is intrusive and unwanted thoughts, and then you do a behavior to get rid of those thoughts. And it's a cycle that repeats, and you really just can't help it. It's very difficult to manage depending on the level of OCD that you have. Lastly, anxiety is also prevalent and manifests in PTSD, post-traumatic stress disorder. And that's a disorder that someone may be diagnosed with following a traumatic event or series of events that follows, or what follows that experience is a series of symptoms. So nightmares, emotional numbness, trouble sleeping, easily irritated, and also PTSD has very long-lasting impacts on your life. And so there's the fear, there's the anxiety of that traumatic experience that manifests in those symptoms. I'm going to emphasize this once again. Please don't diagnose yourself after we've gone over these. Really, we encourage you to seek support. Andrea's going to talk about that in one moment. Our intent to go through these was to help you raise awareness of what these characteristics and experiences and symptoms that you may have has a name to them, and that you can get support to manage them. Or maybe you see them in a friend and you want your friend to get support. Also, please, please, please try to be kind to yourself. As I was saying, it's super easy to label yourself after you list all these. And maybe that label is like, I have a problem, or I'm broken, or I need to fix this. And you don't. You're a human. It's okay to experience these things. And so we're here to support you and know that you're not broken. So how can you get support then? I'm going to toss it over to Andrea, and she'll tell you a little bit more.
Unmuted. Perfect.
There you go.
All right. So when we were talking about seeking support, sometimes we see things in friends or family members that are concerning and shoot up a little red flag here or there. When that's around anxiety, that can be troubling. Watching a friend suffer with mental health concerns can be challenging for everyone. And so by hopefully giving you a few tools to help either a friend or maybe yourself go through the process of seeking support and getting some help, we thought it might be helpful to have a few bullets here. So really, first and foremost, if you're concerned about this, either for yourself or somebody else, have a conversation, talk to somebody, talk to the person you're concerned about. Be there to listen and understand. Don't practice maybe your responses, your thought, going through, oh, they're saying this, I'm going to respond this way, because you're not listening as well as you could be, right? I do this all the time. Like I'm listening to somebody and I'm like, oh, I'm going to say this, and then I missed the second half of what they were saying. Be intentional about being there to listen and have this conversation. Avoid lecturing. Obviously, you need help, you're sick. All of that is not helpful in helping somebody find or seek support. So do your best to be a supportive listener and have a conversation. Start with communication. Do your best to use concrete examples. So as the example here states, every time we go to class, I feel I have to walk on eggshells around you because you're irritable. So maybe instead of that response, or because that's a really good response, instead of saying like, why are you so mad all the time? Like, that's less helpful, probably. So speak from your experiences, talk about what you're experiencing and why that's concerning to you. Do your best to have concrete examples, and maybe an even better, instead of just saying you're irritable, you've like snapped at me 4 times this week. Why? Like, can we talk about that? Something like that. And then contrast the behaviors as you give these examples too. So you have the most wonderful sense of humor and personality, but when you're anxious, you avoid being around your friends. So we know that they value being around their friends and their friendships and family, but they're avoiding everybody because of the anxiety they're experiencing. So distinguish between the person that you like and the behavior you don't. We miss you. I wish I could see you more often. Is there anything to help you spend the time that you want with your friends and family? Because again, it's how can you help folks align their actions with their values? And if they value positive, healthy relationships with friends and family, but they are feeling really socially anxious and avoiding social situations all the time, how do you help them balance that? Or how can you um, present this information in a way that maybe will help them see that? Also, if any of this is sounding familiar, aligning your own decisions with your values can be important. So then, as we're helping a friend, recognize that you can't control them. You are the only person in the world that you can control. Everybody else gets to control themselves. But what you can do is help support them and do what you can to be there for them. In that, they also have to desire to change for themselves. You can't convince somebody just because I want you to get better is not enough for somebody else to make a change. Also, recognizing when it's beyond your control or beyond your ability to help. When you see somebody experiencing that fear, worry, anxiety cycle, acknowledging that it might be time to seek professional help. Offer to go with them, whether that's helping them set up the appointment online, walking them over to the counseling center, one of our counseling centers here on campus. Provide them resources. It doesn't just have to be a one and done. There might be lots of different opportunities for folks to get help. Always offer them the opportunity of a listening ear. The professionals are there and they're trained and they are really intentional to help. And so being intentional about why it might be time to go see somebody could could be helpful. We also have our Students of Concern form online. So if you have a friend that you are concerned about, but maybe aren't feeling comfortable approaching them or talking to them directly, you can fill out an anonymous form. It's a confidential form. It's not anonymous. You do include your name and contact information, but that might be able to, but it would be kept confidential from the student you're reporting on. So especially if there are any faculty or staff here, you can always submit that student of concern form, at which point somebody from the university will reach out and make sure that the person is supported appropriately. Also, if anybody is ever expressing thoughts of suicide, always, always, always treat this as an emergency. Um, it can be really distressing to hear somebody say, I don't want to live anymore. Ask the question, are you thinking of hurting yourself? And if the answer is anything other than no, call 911, call the suicide hotline, help somebody get the help that they need. Um, so always, 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 anytime suicidality comes up, it's important to get help. Now I'm going to turn it over to, oh, no, I have a few resources specifically. Um, so these are 4 of the counseling services available directly on campus. Um, there are wait times or wait lists for many of these right now, but know that you will still be seen for an appointment, for an initial appointment to offer resources before being potentially put on a wait list. So counseling and consultation services, room 200 in the Campus Life building. Also, they're doing most of these places, I think all of these places are doing telehealth counseling currently. If you're going to be in the area for the summer, all of that is available as well. These are the 4 services. No, you're fine. And they're available, the websites and everything are available on the A to Z index under counseling services. There are other mental health resources we wanted to make sure you were aware of. Obviously, we are offering presentations, we have educational information. If somebody just has kinds of general questions about how to respond, all of that is available. Sarah just shared in the chat what those earlier resources were. And what some of these are as well. So Psychology Today has additional information, like our Mission Wellness does as well, on mental health topics. Also, Psychology Today can help you find a provider through your insurance if you're not utilizing the on-campus resources through CCS or the CCTC or others. We also have our NAMI crisis hotline or crisis line, or the National Suicide Prevention Line, the NAMI line, and the Trevor Project. These are all call and text lines that are supported 24/7. Anybody can call to help address any current issue that they're experiencing, or if you're with a friend and they express either the suicide intention or anything like that, these are some of the resources that you can utilize in that moment. Now I'm going to turn it over to Sarah to talk a little bit about, in the meantime, if you are deciding whether or not to get service, or maybe you've had your initial appointment and are waiting for a second appointment, there's some things we can do to help in the meantime.
Yeah, thanks, Andrea. Whether you are seeking mental health support on campus through any of our services, or you're seeking an outside provider, it does take a little time before you go to that first appointment. And if you're feeling and experiencing high levels of anxiety, that could be more anxiety provoking, and you're really wanting to lower those levels. So what can you do while you're waiting? First, take care of your body. So eat a balanced diet every day, or try. We recognize it's hard. Get that full hours of sleep at night. It's recommended to get 7 to 9, I believe. Yep, I'm getting nods from Andrea. 7 to 9 is the recommended amount for adults. And get some exercise. Exercise can be so helpful for mental health, even if it's just walking. That's what I do because I'm not athletically inclined. So I walk as much as I can. Connect with your friends, connect with your family, connect with the professor, talk to somebody. And a lot of the times when you connect with somebody, you'll find you are not alone. And that feeling can really take a weight off of your shoulders. Practice self-compassion, be kind to yourself. So if making that first appointment was really difficult, as it is a really difficult first step, there's that self-compassion you could do right in there. Wow, I did a really good job. I did it. I made that first step. Good job, self. That could be really impactful. Reframe negative thoughts. If you're having that worry, replace that worry with a more positive thought. So I'm really dumb. I'm really stupid. How could I be this anxious? Reframe it with self-compassion. It's okay that I experience this anxiety. It's a human experience. I'm going to be okay. That takes practice and help with the provider. And along with these next 2 suggestions are really impactful when you work with a mental health professional. So anxiety tells you to run away from something. I encourage you to run right into it. Or if anything, sit in the moment and feel your anxiety and use that self-compassion reframing of thoughts. And mindfulness can also be really helpful. Can't dive into it too much right now as we are nearing the end of this, but I would encourage you to look up mindfulness, self-compassion, and reframing negative thoughts on your own time to see some great examples. Last 2, find some time to really express yourself and express your thoughts and feelings. Getting that off of your chest and mind could be exceptionally helpful if you're a worrier like myself. And if you can, take time off for yourself. Practice that self care, treat yourself truly. Taking some time to just breathe and step back from everything can be exceptionally helpful.
And I just want to acknowledge that taking time off doesn't mean like you have to take a whole day. You may
Mhm.
be able to just take 10 minutes away from whatever it is at this moment. So the time off, it sounds like, okay, I need a vacation. Yes, if you have time and available for
Yeah.
that, great. But also a 10-minute break to go take a trip around the block might be really helpful in the moment.
Yeah, thanks for that, Andrea. However, in whatever shape or form works best for you to just take a step away from things will be really helpful. That is all the time that we have today, as there is so much to talk about when it comes to anxiety. We hope this helped to raise awareness about how to seek support. We do ask that you take our survey. I just put it in the chat. It really helps us to improve the information we share, what events we do, what you thought, and helps us to help Huskies even more. But thank you for attending. Andrea is going to be around to answer any questions if you have any, but thank you so much for joining us.
You're very welcome.
Thank you all for joining us. We appreciate it.